Dr. Parth is here. He's not here, but he's given a very good video. I think we shouldn't give marks on it. No marks. Yeah, use of now iris clip claw lens is big. And coming a big way. It's much easier than doing the SFIUL. Of course, everything has its advantage or disadvantages.
From the pupil, the iris will be stretched, leading to ovalization of the pupil with consequent correctopia. Here, the intervention is non-standardized and requires relevant surgical skills. To overcome the mentioned challenges, we demonstrate an alternative technique of iris claw implantation, which uses a needle as a guiding wire for perfect centration. This is a case of IOL calcification, which needed explantation. Corneal incision is widened to accommodate the IOL which is being explanted. Thorough anterior vitrectomy is being performed to avoid any vitreous traction during placement of the iris claw lens. Air bubble is injected, following which pilocarpine is injected to constrict the pupil, helping to form a uniform round pupil. Anterior vitrectomy is repeated. We wait for the pupil to constrict. A long 10 of proline straight needle is placed in the cornea. The lens is held in the center of the optic with a lens holding forceps and inserted in the anterior chamber to the corneal incision. With the needle being a guide to centration of the IOL, it is carefully implanted in the retropupillary plane. Nasal claw is enclosed in the mid-iris or the 2/3 1/3 junction of iris tissue, since it is relatively thin, avascular and non-dilating part of the iris, followed by the temporal claw. Viscoelastic is injected and the needle is removed. Sutures are placed to seal the corneal wound. Viscoelastic wash is carried out and the side ports are hydrated. Peripheral iridectomy is made in order to prevent pupillary block. The needle serves as a guiding wire for perfect centration and helps do away with the need for a second instrument. The advantages of this technique include that it uses only a single instrument, which makes the surgery very easy. The instrument acts as a third hand and an anterior chamber maintainer as well. Perfect centration can be achieved with this technique. We decided to name it the nail technique, which stands for needle assisted iris claw lens implantation.